I think Jack is here, but in the interest of time, I won't invite him to speak just because we'll run out of time. So one of the things that happens across Greater Manchester is the Health and Social Care Partnership set up a carers delivery board a good few years ago now, and there was a carers charter that was developed, lots of publicity and communication about how we support carers within Greater Manchester. From the Carers Partnership Board, there was some subgroups, one which was focused on parent carers, carers from ethnic backgrounds, and carers into employment. So the project that we led very much fed into the subgroup that focuses on carers from ethnic minorities. Can we have the next slide, please? So where did this project and idea come from? So in 2020, we did a really short piece of qualitative research. At that time, the country was in lockdown. It was that time of the year in 2020 when, you couldn't go out to the shops, you could only go out once a day for a walk. And somebody got in touch with me and said, we've got some funding left. Would you like to do some work around it? And I had been thinking about how families were coping who were carers. And I said, yes, I'd love to do some work and speak to some carers from the Asian community. Actually, at that point, it was from carers from the any ethnic minority, to be fair. But what came out of that project and those conversations was about the issues around carers from Asian communities, about not having access to halal food, for example, and being worried about going out of the house. And also at that point, the impact of not being able to go to their faith community. So their support networks in the mosque and other communities, that they weren't able to go there, and how isolated they were feeling. So those were the conversations that we were having when we did that piece of research in 2020. Can we have the next slide, please? Okay, so the aims of the project, Mind the Gap project, was to understand how to help carers from Asian ethnic backgrounds to identify what matters to them most, to understand the adjustments needed so that they could get the support they needed, to develop an Asian carers network, and to co-design recommendations with carers from Asian ethnic backgrounds. Can we have the next slide, please? So two things that we had to do. First of all, obviously, with the whole of Greater Manchester, you've got 10 local areas. The directory of organisations, which when I started the project, I thought was actually going to be quite a small task, actually turned out to be huge, because there was no directory. There was no one place to go where you could find, if you had somebody from Hong Kong, for example, we've had quite a number of families from Hong Kong recently. Where would you go and find out where the support was for them? You couldn't. So actually getting that directory together took quite a long time, and it was, as I've put in the slide there, a lot of legwork. It was actually going through Facebook, putting in a search in Facebook for that particular group, carers for Asian support groups in Bury, for example, would be one of the searches. And sometimes the Facebook groups, they didn't have an email address. It would just have a phone number. And sometimes all they had was the Facebook group. There was nothing else. And it would just have a poster on it saying, on a Thursday, 12 till 1, we meet in such and such a place. And then in Manchester, obviously, they have a huge list of support groups, some of that are more established than others. And again, when we were going through the websites, internet searches and Facebook groups, sometimes it was just a phone number. And also what we found was that sometimes you would get in touch with one group and they'd say, oh no, we don't really focus on that. You need to speak to so-and-so. And they'd give us a phone number for somebody who was working in Levenshulme, for example, which has a huge Asian community. And that group or that person only supports the carers in, a half a mile radius. And they have a list actually written down of who they're supporting and the families that they're helping. That's sort of how small we had to get. So from being Greater Manchester 10 local authorities, we took a long time to whittle down to a few people who were working in specific areas, almost ward level, really, in each local area. And that took quite a long time, but we have got a fairly good directory. But obviously with these things, they change, don't they? New people come in and other people leave. Some of the organisations that I'd worked with in 2020, I went back to, and we advertised for 10 members to form a group. We met weekly, and they were actively engaged. The women, we built up a really good relationship. We do still keep in touch with each other, even though I didn't necessarily want to have to do all the sessions online. It was just too time consuming for those carers to leave what they were doing and come into a physical meeting, and it wasn't really worth it. They did all have, in the bid, we made sure that we put in funding so that they could be funded, rewarded, gifted. They had vouchers for their time. So every week they got some sort of recognition of their experience. Can we have the next slide, please? Okay, so this is the main slide really that I wanted to go through. What came out of it really was 4 themes. One was awareness raising. We had a lot of conversations about the fact that people within the Asian community don't just see it as their responsibility to look after their loved ones. It's just what they do. If one of the women said, if your family don't look after you when you're old, then it's frowned upon because they think you haven't raised a good family as a mother. And that was quite shocking to me, that they didn't actually want to go out and ask for help because it was frowned upon within their community. So we talked quite a lot about how to overcome that, and came up with things like the event, the Family Rights Day. So rather than having it as a carers event, bring the whole family. A lot of the elderly people within the Asian community don't use technology, but their grandchildren do, or their children do. So we decided that in order to get the message across, we would have it as a Family Rights Day. We'd advertise it through secondary schools, and the children could encourage the rest of their family to come along and learn about what was on offer, rather than have it as a carers day. A celebration event. We talked a lot about faith groups, and they're really quite an important part of the community. That took up a lot of time in our conversations. We talked about leaflets, having things in other languages. There was a lot of conversation as well about urgent care, and that comes through in the theme communication and respect. Interpretation services, again, there was quite a strong feeling on that the NHS wastes quite a lot of time and money funding interpretation services for appointments, when quite often it's the family member who do the interpretation. So if you have an elderly person that you're caring for who doesn't have English as their first language and also has dementia, so needs the conversation to be quite simple, and also they might only converse in a certain dialect, you're going to struggle. An interpreter is going to struggle with that. So the family member was often doing the interpretation despite the NHS paying for an interpreter, which was a bit pointless. And again, some words in different languages don't have a direct translation. We talked as well about having an e-module training. That was a really significant recommendation for us. There was an online training session for health and social care professionals to do into the needs and issues related to carers from Asian communities. We are going to take this to our Greater Manchester Carers Delivery Group, the big group, and come up with some recommendations for the whole of Greater Manchester, and pulling it all together by having a Greater Manchester Asian Carers Network, which involves everybody who has an interest in supporting these families and people. And hopefully they will either come up with some funding or link people together so that some of these recommendations, mainly the Family Rights Day, and the e-training module can actually be taken forward over the next year or so. But if anybody has any questions or wants to know more, I'm really conscious I absolutely rattled through that 100 miles an hour. Please just send me an email or get in touch. Thank you.
Steve's going to move us to our rooms in a second, but Jack, I can see you're typing. If you want to say something, please pop on and go for it.
Such a great piece of work, and made possible by Elizabeth's incredible personable skills and engagement and willingness to really get stuck in and communicate and engage with people in these communities. Really great. The one of the best things that came out of this project, which I don't think Elizabeth had a chance to show, is these kind of illustrated directory images that were produced by the carers involved in the groups, and they kind of got these beautiful illustrations, and they like infographics, but hand drawn and really intricate and really informative, and really interested in ways that we can acknowledge the artists, but also use those in Great Manchester, because they're really great. And yeah, just big applause for Elizabeth for such a commendable project.
Definitely, I'd echo that. It's always interesting when you think you're going to have a relatively straightforward task, Elizabeth, isn't it? And then actually you kind of lift up the rock and it's actually all very, very complex, actually. Does anyone have any other questions for Elizabeth or Jack from Greater Manchester, or indeed Prince?
Well, if we got a few minutes, I can say a few things.
Go on, Prince.
Yeah, just another interesting thing that well, for me it's interesting is that our place committee are now very interested, because one of the we have 6 key kind of I always think when people talk about priorities, I always find that very strange, because you should only have one priority, and yet people say we have 6 priorities. But anyway, in the Royal Borough, we have key areas of focus, 6 key areas. And one of them, believe it or not, is a care. And for each one, we're going to establish a kind of a board, a strategy board to take them forward. And so I had been asked to kind of look at working with the council for us to put together our carer strategy. Each board is supposed to have a strategy. And I remember saying, well, actually, I don't want to develop a strategy, because because I know exactly what we need to do. Okay, and we have employed someone who's actually going to do exactly that. There's no point in me putting strategy. We know what needs to happen. We just need to put the resources to make it happen. Okay, and so it is good that we have a carer coordinator, if you like, who will make sure that it doesn't matter. I mean, we've done some work around dementia as well. We know people from the carers from dementia, but it doesn't matter. The idea is that it doesn't matter what carer you are, what age you are, and who you care for. Okay, if you need support, we will be there and we will support you every step of the way, because we want you